Morning, folks. This is just to allay some confusion. So this will be the last Monday, hopefully forever, that we'll be doing a town hall. Starting in March, it'll just be Wednesdays. So next week will be Monday and Wednesday this week, and starting next week and through the month of March, it'll just be Wednesdays, and then hopefully we can wind down from there. So Monday, Wednesday this week, next week just on Wednesdays. A lot of stuff today. First and foremost, tomorrow is the second and big vaccine clinic here in Williamsville. So all of our residents here in Williamsville who got their first vaccine will be getting their second, and some staff as well. And so everybody will be fully vaccinated. Same process as before. Lexington Village and some other folks will be coming into this room, Canterbury Hall. And then for everybody else in the main building, we will be going apartment to apartment with a pharmacist from Walgreens, a staff member, and a follow-up from a nurse. So should go as smooth as it did the first time. I was talking to some of the residents down at Gate Circle on Friday because dining opened up at Gate Circle on Friday. So they had a nice dining experience there on Friday, and it's ongoing. But they got their second vaccines last week, and many of them had very little kind of symptoms afterwards. If you remember, I've talked about it. You know, some folks are experiencing flu-like symptoms within the 24 to 36 hours after you get that second dose. So if you do, and they're excessive, certainly use your PERS or take note, but they go away. So again, dinner started at Gates on Friday. I was fortunate enough to be down there for that, and I thank the staff. They did a nice job, and it's certainly nice to start getting to normal. Dinner and lunch starts here in Williamsville on Friday. So Friday lunch, you will not need a reservation for lunch in the main dining room starting this Friday, but you will for dinner. You can start making those reservations for dinner. Excuse me, as I try not to sneeze. I don't know what this is about, but you can start making those reservations for dinner now. And going forward, probably for a first couple of weeks, we'll do reservations for dinner. The goal is to be able to not have reservations for dinner and go back to normal. But really, when we start having 4 people to a table, etc., which will be a few weeks out, then we'll go back to normal here in Williamsville and have no reservations for dinner. So again, no reservations for lunch starting this Friday, but reservations for dinner starting this Friday as well. You will see here in Williamsville all of the furniture going back in the common areas starting on Wednesday. So all throughout the building, the common area furniture will be coming out. Most of the carpets have been cleaned and touched up and so on. So by Friday, all of the common area furniture should be fully restored. The only things that won't be out are chairs. No chairs in the cafes yet. Cafes will be grab and go starting on Monday with no chairs, but those chairs will be back soon. Pool. So the pool here in Williamsville had to be resurfaced, and there was cracks in it, and some extensive work had to be done. So obviously we use this time frame to do that. That has been completed, and they tell me that it's going to be ready to go by March 1st, so next Monday, the pool will be ready to go. Other big news is the store. The store here in Williamsville, as we speak, is being painted for the first time since 1999. So painted and spruced up, etc. And Paul, I know, has been working with some residents. We have a bunch of new offerings and stuff that's going to be for sale in the store, so that's exciting. I know that has been a challenge in the last couple of years, but the store is going to be much more vibrant than it's ever been before. And I know that particularly Paul's been working with Mrs. Rosenau here, who has been coordinating the volunteers at the store for several years. So I understand that the volunteers are excited to get back in. The store is going to be open starting next week with a fresh new paint job, and they're also working on a name for the store. So the store has been called The Store since I've been here and beyond. So I think it's great. They're working on a name. They're going to have all kinds of new stuff in there. And yeah, March is going to be a great month. Outpatient therapy. So we had to suspend outpatient therapy here in Williamsville for the last several months. Outpatient therapy is actually going to be starting again on March 1st. We have a room that we use that is in the back of our fitness area, kind of a separate room back there. The therapists use that for our outpatient therapy clinic. I know that Sabrina and the therapist have been and will be reaching out to people here at Williamsville, and if you want to come here from Gates, you can certainly do that. Folks that want to go to outpatient physical therapy primarily, some occupational therapy as well. Here on site, we have the ability to do that. You have to have a doctor's prescription to be able to do that. If you have questions on that, you can certainly call down to Sabrina Andrzik in our physical therapy department, and she can walk you through that. But I have had questions recently about occupational therapy, and that is beginning next week. So, man, I have like 8 things on my list here that we've gone through. So, dinner this week at dinner reservations this week here in Williamsville. Lunch, no reservation. Both of those start on Friday and will continue. Of course, the big vaccine clinic is tomorrow here in Williamsville. I'm going to touch on one other thing before I'm done for the day. And this is a little bit about what's going on in Albany right now with the governor and nursing homes, etc. I've gone back and forth whether I was going to say anything, but clearly I've already dipped my toe in the water, so I'm going to. So, as you're reading and seeing, there's a lot of controversy embroiled in Albany on an issue that we're aware of and been aware of for many, many months, and that's the underreporting of the deaths of nursing home residents within the nursing homes in New York State. And then further on top of that, the poor decision, or more than poor decision, the disastrous decision that was made at the state level for nursing home residents to have to be returned from hospitals back into nursing homes, COVID or not. And this was March, April of this year. Remember me talking about it in April, and we actually refused to do that, which caused some turmoil locally. Well, now, it's a political issue. I don't want to put my politics on the table, but, historically I've been a supporter of the governor for a variety of reasons. And I even understood, the decision back in March, April. I didn't agree with it, thought it was terrible, but I understood it at the time because what they were trying to do is protect the hospitals. Nobody knew how bad it was going to get with COVID back in March and April, and everybody was kind of reacting to the information that was out there at the time. And I can certainly understand that the powers that be thought there was going to be an onslaught and an overrunning of our hospitals throughout the state, and so they picked that as a way to alleviate that potential problem. Well, that really didn't happen. To a large extent. Obviously it was bad down in the New York City area, but certainly not in upstate as bad as it was down in New York City. And so, what happened is, many nursing homes took COVID positive residents back in at that time period, and unfortunately lives were lost. So, I understood at the time, didn't agree with it, thought it was a terrible decision, but I could understand the thinking behind it. Now we roll ahead, and here we are in January, February, close to a year later, and now we're playing politics with nursing homes again. And, instead of dealing with the problem, instead of admitting the problem, it's always easy to point fingers and to push blame and say that, it's really a nursing home issue, and now we need to push more regulations. And and fix this or that. Nursing homes are always an easy target. And I've been a nursing home administrator, and I've been in long-term care for almost 30 years in New York State, and I've seen it all. I've been in I've worked and experienced every single part of long-term care you could possibly imagine. I've worked in for-profit, obviously not-for-profit. I've worked in huge hospital-based systems. I've worked in county and government system, union, non-union, pediatric care, AIDS care, tuberculosis care, Huntington's disease, ventilator units, behavioral units, you name it. As a long-term care professional, I've been a part of it, and so I've seen the evolution of long-term care over the last 30 years. The problem is this: you can point your fingers, and the politicians can, try to deflect. The problem is money. It comes down to money. You cannot continue to regulate the long-term care industry, cast blame, mandate staffing. I mean, let's face it, we're all in favor of outstanding care. We're all in favor of great staffing. We all want to do the best job we can for our residents every day. I don't care if you're in the for-profit side, the nonprofit side, the governmental side. If you're a long-term care professional, you come to work every day and you want to do the best you can for the residents. The problem is the money. The problem is that New York State, as with many states, has been playing around with how much money that they pay to nursing homes, specifically through Medicaid, for years. It's like this annual football of what are they going to cut, how much money, and how do we beat our heads against a rock this year to make it all work. I'll give you an example. So Canterbury Woods, we're the fortunate ones. We are the utopia of long-term care on the skilled side because we have the money to be able to have robust staffing and equipment and infrastructure and all that stuff. But, as I've told the residents many, many times, when you look at the financials of Canterbury Woods, we lose hundreds of thousands of dollars specific to the nursing home every year because that's the model. The way our model has set up from a business is that we lose money in the health center and we make it up on the other side of the business. Well, most places can't afford to lose money as a health center. I mean, there's reasons why there are no it used to be back in the 80s and 90s, etc., there were mom and pop nursing homes all over the place. Every town had one. You look at some of the local little chains. Elderwood's still here, but it's not what it was back then. It's not Bob Core's nursing home chain, who I actually worked for back in the 90s. Outstanding quality of care. There was money in the system to be able to do that. There's reasons why there are no mom and pop nursing homes anymore. That on the for-profit side, they're all huge chains, owned by somebody down in the New York City area typically, and there's dozens under different umbrellas. There's reasons behind that, because it's the only way that these nursing homes can survive is to spread out costs. They are not every individual nursing home is not making a lot of money or making much money. It's a collective, and that's why they have to have these big chains. But nursing homes are needed. So, the state kind of looks the other way a little bit, because what are they going to do if these nursing homes go away? Where are these people going to get care? Here at Canterbury Woods, our Medicaid rate is $168 a day. So for any of our residents, of which we have very few, but those that are on Medicaid, we get $168 a day. Now think about that, $168 a day. That, to go to a decent hotel, you would pay more. Think about the costs that go into the provision of skilled nursing care for $168 a day. The nursing staff, the equipment, the nurses at all levels, the food, the dining staff, all that stuff, the infrastructure. Our cost to provide care at Canterbury Woods per day is $346. So we get $168 per day for Medicaid, but it costs us almost $350 a day to provide care for that same person, for all people. So therein lies the problem. We can absorb that cost because we have economies of scale and we can spread that cost over our continuum. Most nursing homes cannot. So when you hear the calls for better staffing and mandated staffing, and we're going to come down hard on nursing homes, et cetera, from the politicians who are just doing it to deflect blame and push the issue off on others, that's really all they're doing. Because nobody is going to really attack the problem. If you want better nursing or better care, if you want better staffing, then New York State has to come up with the money to support that need. It's as simple as that. The Medicaid rate on an annual basis historically goes up less than 0.5% a year. So we've been at about $168 a day for 5 years. But our costs have gone up. People get raises. Healthcare costs go up. The cost to give care goes up. But in New York State, they play games with the rate. And then when things go bad, which weren't the nursing home's fault, what do? They turn around and blame the nursing homes. This is the reality of providing long-term care, not only in New York State, but throughout the country, where we've been in the eye of the COVID hurricane for over a year now. Putting this out there because, again, I'm fortunate, supremely fortunate. We all are to be working here at Canterbury Woods. And I thank God every day that I get to drive on this campus or go down the Gate Circle. But I've also been in long-term care for 30 years. And quite frankly, I'm sick and tired of every time there's a problem or challenge, especially what's going on right now, is the nursing homes get blamed. It's not the nursing home's fault. The system's fault. It's the fault that there's no money to support what the genius politicians are purporting to do. They can talk all they want. All they're doing is making things worse. If they really want to do something, they'll put money back into the system. Thanks.